Today we are going to discuss on bipolar affective disorder. This comes as a long case in psychiatry. So let's focus on bipolar affective disorder. You can see that there are mania and depression. These episodes can be seen in bipolar affective disorder. So now we are going to focus on this disorder. First we learn what is mean by affect and affective disorders. Mood mean sustained internal state of mind. Affect is expression of internal state, that is a transient one. Variation is more than normal. So problem in occupational and social functioning. Bipolar affective disorder, there are high mood, normal mood, low mood. There are hypomanic episode and normal episode and depressive episode like an etc. can be seen. There you can see manic episode like this. Manic episode can be seen in depressive episode like this, can be seen in hypomanic stages, can be seen. Normal mood can be seen. In mixed episode, there is increased speed of speech, that is a symptom. Phases of bipolar disorder, that depression, mania, hypomania, mixed episode. Mixed episodes mean that curve is this and the lower curve is there. That is that is a mixed episode. Hypomania, I said depression. This is a mixed episode. Sorry, this is mixed episode, mania, and there then depression. That's a mixed episode. In depression, there is poor sleep. In mania, patient doesn't sleep. Angry manic patients are violent. People with single manic episode without depression can be given treatment of bipolar disorder. Mood episode are depression, mania, hypomania mix. Depressive episode, unipolar depression and bipolar depression. Does diagnosis criteria change? Depressive episode, persistent depressive mood, lack of enjoyment, lack of energy, poor attention and concentration, poor self-esteem, guilt, pessimistic ideas. Pessimistic ideas mean negative thoughts. Pessimistic idea means and poor sleep, appetite, suicidal thoughts, delusion, hallucination for 2 weeks can be seen. In manic episode, there's elevated mood, usually out of keeping with circumstances. Increased energy with many may manifest as overactivity, pressure, speech, flight of ideas, racing thoughts, reduced need for sleep, and increased self-esteem, evident as over-optimistic ideation, grandiosity, reduced social inhibitions, over-familiarity, which may be overly amorous. Reduced attention, increased distractibility, tendency to engage in behavior that could have serious consequence, preoccupation with extravagant, impracticable schema, spending neglectlessly, inappropriate sexual encounters, other behavioral manifestation, excitement, irritability, aggressiveness, suspiciousness, marked disruption of work, usual social activities, and family life. For diagnosis, symptoms at least 1 week. Manic episode, severe enough to disrupt ordinary work and social activity. Mood change, elevated mood, irritability accompanied by increased energy and several other symptoms like pressure of speech, decreased need for sleep, grandiosity, excessive optimism. Then now we discuss about hypomanic episode. Persistent mild elevation of mood for at least 4 days. Increased energy and activity, feeling of well-being, increased sociability, talkativeness, over-familiarity, sexual energy. Hypomanic episode, decreased need for sleep. No marked impairment, social occupational activity, no psychotic features. Mixed episode characterized by either a mixture of very rapid alternation between prominent manic, hypomanic, and depressive symptoms on most days during a period of at least 2 weeks. Common risks associated with manic episode: suicide, physical exertion, dehydration, aggressive episodes, violence and risk of homicide, overspending, sexual disinhibition, poor treatment compliance, suicide. Classification of ICD-10. If patient is presenting with first ever manic episode and no history of depression, hypomanic or manic episode, diagnosis is manic episode. Hypomania, mania without psychosis, mania with psychosis. To diagnose bipolar affective disorder, more than 2 episode mania or hypomania plus depression there should be. ICD-11 and DSM-5. When patient present with first episode mania or mixed episode, no history of depression, hypomania, mania, diagnosis of bipolar affective disorder is given. Bipolar 1, mania, depression. Bipolar 2, hypomania, depression. Bipolar affective disorder, current episode hypomanic. Bipolar affective disorder, current episode manic without psychotic symptoms. Bipolar affective disorder, current episode manic with psychotic symptoms. Bipolar affective disorder, current episode mild or moderate depression. Bipolar affective disorder, current episode severe depression without psychotic symptoms. Bipolar affective disorder, current episode severe depression with psychotic symptoms. Bipolar affective disorder, current episode mixed with psychotic symptoms. Bipolar affective disorder, current episode mixed without psychotic symptoms. Epidemiology, lifetime risk 0.3 to 1.5%. Females, males, equal engagement can be seen in this disease. Mean age of onset 17 years. Patient with recurrence 90%. Average number of episodes over 25 years 10. Highly comorbid with anxiety disorders and drug misuse. Etiology, genetic factor heritability 85%. Combined action of multiple genes, polygenic inheritance there. Environmental factor that is not specific to bipolar disorder, childhood sexual abuse, disrupted sleep, life event, high express emotions. Etiology, functional brain abnormalities, disordered emotional regulation and rewarded process, exaggerated functional response to positive emotional stimuli. Cause and prognosis of bipolar disorder usually begins as depression. Average length of manic episode about 6 months. 90% patients with mania experience further episode of major mood disturbance. Over a 25-year follow-up, experience about 10 further episode of major. Mm, Interval between episode become progressively shorter. Depressive episode more than manic episode in both BPAD and 1 and 2. Prognosis good recovery for acute episode. Long term poor sleep prognosis. Prognosis to bipolar disorder, better outcome. Persistent cognitive deficit and mood instability predict poor outcome. Differential diagnosis of mania, schizophrenia, schizoaffective disorder, organic brain disease involving frontal lobes like brain tumor, HIV, state of brief excitement induced by psychoactive substance like amphetamine. Okay, now we will end up this. Um, the first part of the bipolar affective disorder. Thanks for listening.